Welcome. My name is Peter Strong and I'm a professional online therapist. I specialize in online therapy because I find it a very effective way of helping my clients overcome anxiety and depression and other emotional problems. Uh, Most people, and perhaps this applies to you too, that are suffering from anxiety or depression, really what they need is a way of working with the psychological process that creates that emotional suffering. Medications and the medical approach don't really treat this psychological habit that creates anxiety or depression or panic attacks. Medications only alleviate symptoms temporarily, but they do not change that underlying psychological process. And that's really what I am offering online through these Skype therapy sessions. I specialize in mindfulness therapy, and mindfulness therapy really works extremely well with anxiety and depression. It does help you change the way that you relate to your emotions, and that's the most important thing that needs to change. The habit is to become identified with our emotions and our thoughts. This identification reaction feeds the anxiety or depression, and it stops it from changing or resolving. One of the primary themes that we understand in mindfulness therapy is that when you change the habit that feeds anxiety or depression, then that anxiety or depression will begin to resolve by itself. It will reduce in frequency and it will reduce in its intensity if you stop fueling it, if you stop feeding it through patterns of habitual reactive thinking. So that's a prime focus of mindfulness therapy, which is what I teach during these Skype therapy sessions for anxiety and depression. Most people see really substantial changes after relatively few sessions. Why? Well, simply because we focus very specifically on changing those underlying habits. And I teach you tools that you can apply yourself between sessions to really accelerate this process of overcoming reactive identification. When you do that, then everything begins to change very much quicker. No amount of medications will do that for you. Even talk therapy by itself is not enough. You have to change those patterns directly. Talking about your emotions also produces temporary relief from symptoms, but it doesn't change that underlying process. And until you do, the anxiety or depression will simply return when the triggers are present. So if you'd like to learn more about Skype therapy for anxiety and depression, simply email me and we can schedule a Skype therapy session. Thank you.